disorder, bipolar disorder. The DSM-4 says there are 3 types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymic disorder. 0.8% of the population is affected by bipolar 1 disorder, while 0.5% of the population is affected by bipolar 2. In order to be considered to have bipolar disorder, you need to have manic episodes as well as depressive episodes. A manic episode is defined as a period of at least 7 days where you have an abnormally elevated or irritable mood, and you also need to have at least 3 of the following symptoms: increased goal-directed behavior, pressured speech, racing thoughts, decreased need for sleep, grandiose sense of self, easily directed, or decreased areas of judgment about business, work, and social areas. A major depressive episode is defined by lasting at least 2 weeks and no longer than 2 months. You also need to have 4 of these depressive symptoms for it to be considered a depressive episode: sleep disturbance, appetite disturbance, weight change, loss of energy or fatigue, difficult concentrating or making decisions, recurrent thoughts of suicide or death, and psychomotor agitation or psychomotor regression. Now I'm going to talk about the 3 types of bipolar disorder, starting with bipolar 1 disorder. Bipolar 1 disorder is characterized by 1 or more manic or mixed episodes. You do not have to have a depressive episode. Bipolar 2 disorder is characterized by a major depressive episode and at least 1 hypomanic episode. Hypomanic means it is not as severe as a full manic episode. There's cyclothymic disorder, which is chronic mild bipolar 2. So you have mild depression as well as hypomania, and it's usually chronic and lasts longer than the bipolar 1 and bipolar 2. Bipolar 1 disorder usually starts at 18 years of age, while bipolar 2 disorder usually starts at 19 to 22 years of age. Cyclothymic disorder starts usually a bit younger at 12 to 14 years of age. Rarely do people get bipolar disorder after 40 years. Bipolar disorder generally affects men and women the same. Suicide is a common consequence of bipolar disorder. Men tend to complete suicide at a higher rate than women. Suicide also usually happens during the depressive episode in the bipolar period. Since suicide is such a problem with bipolar disorder, there must be a way to treat the disorder. There are different treatments for mania and depression. Usually there is a drug regimen to manage the disorder, as well as therapy to help the patient with the depressive. Family therapy has shown to help, as well as psychoeducation, and even cannabinoids are used to lessen the severity of mania and depression symptoms. Treatment for the mania part of bipolar disorder can include lithium salts, antipsychotics, and anticonvulsants. Treatment for the depression part can include things such as the talk therapy or electroconvulsion therapy. Specific causes of bipolar are not known, but it does tend to run in families, which could mean a genetic factor could be the cause of the disorder, such as a genetic predisposition to abnormalities in their sleep or wake cycle, which could trigger the symptoms of mania or depression. It also could be family related because a child with bipolar parents can grow up in a stressful environment, which could also trigger bipolar episodes. Another cause of bipolar disorder could be a chemical imbalance in these 3 neurotransmitters, such as norepinephrine, serotonin, and dopamine. Alcohol and drug use can make handling bipolar disorder more difficult. Stressful life events the environment and lifestyle can also play a factor in bringing about bipolar disorder.